Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A truly groundbreaking study was published on July 21st, 2022 in the European Heart Journal. The study showed that even in the presence of a moderately high salt diet, individuals who routinely consumed ideal amounts of potassium from food each day showed a reduction in high blood pressure and a significant reduction in death from all cardiovascular causes during the 20-year follow-up period. This is really impressive research. The blood pressure lowering effect of potassium was especially evident for women, and women consuming ideal amounts of potassium each day also had a lower risk of cardiovascular events, 11% lower risk than did men who had a 7% lower risk. We'll get into those details. The study included about 25,000 participants of the EPIC Norfolk study, which recruited 40 to 79-year-old patients from general practices in Norfolk, UK between 1993 and 1997. The average age was 59 years for men and 58 years for women. Participants completed a questionnaire on their lifestyle habits, blood pressure was measured, and a urine sample was collected. The urinary sodium and potassium were used to estimate dietary intake. The results showed that for women, as potassium consumption increased, blood pressure went down. When the association was analyzed according to sodium intake, the relationship between potassium and blood pressure was only observed in women with a high sodium diet, where every 1,000 milligrams increase in daily potassium was associated with a 2.4 drop in systolic blood pressure in women. So women who had a high blood pressure, who were consuming a lot of sodium, for every 1,000 milligrams of potassium they ingested from their diet, they got a 2.4 millimeters of mercury reduction in their systolic blood pressure. In men, there was no association between potassium and blood pressure. So men consuming a high salt diet do not seem to benefit from higher potassium intake in terms of blood pressure lowering effect, whereas women appear to get this benefit for some reason which no one can explain. It seems to help women but not men. However, higher potassium intake appears to help lower risk of cardiovascular disease over and above any blood pressure lowering effect. Thus, both women and men appear to benefit from adequate intake of potassium regarding the prevention of dying from cardiovascular disease or having a serious cardiovascular event like a heart attack or a stroke. More specifically, the median follow-up period of about 20 years as they follow these participants, they look at the individuals who were hospitalized or died due to cardiovascular disease over this 20-year period. The researchers analyzed the association between potassium intake and cardiovascular events after adjusting for age, gender, body mass index, sodium intake, use of lipid-lowering drugs, smoking, alcohol, diabetes, and prior heart attack or stroke. So after controlling for all of that, the results showed that men and women with the highest potassium intake had a 13% lower risk of cardiovascular events compared to those who had the lowest intake of potassium. When men and women were analyzed separately, the results showed that women had an 11% lower risk of having a serious cardiovascular event, and men had a 7% reduction in having a serious cardiovascular event. Once again, women seem to get a greater benefit. And the amount of salt in the diet did not influence the relationship between potassium and cardiovascular events in men or in women. So regardless of sodium intake, just getting that extra potassium that most people should be getting, it helps to lower risk of cardiovascular events according to this study. Professor Voigt, who's a lead researcher on the study, said this, and I quote, "The results suggest that potassium helps preserve heart health, but that women benefit more than men. The relationship between potassium and cardiovascular events was the same regardless of salt intake, suggesting that potassium has other ways of protecting the heart on top of increasing sodium excretion." The World Health Organization recommends that adults consume about 3,500 milligrams of potassium each day and less than 2 grams of sodium or 5,000 milligrams of common table salt. High potassium foods include vegetables, fruits, nuts, beans, low-fat dairy products, and fish. For example, a medium-sized banana has about 375 milligrams of potassium. A standard serving size of salmon has 780 milligrams of potassium. A medium potato has about 500 milligrams of potassium. And 1 cup of 1% milk has 375 milligrams of potassium. There's a lot of potassium in healthy foods. So I've included a potassium food chart below which features healthy potassium-containing foods. But some precautionary comments are also required here. Some people have to be careful about potassium consumption because too much potassium can be a problem for them because they already have a medical condition where their blood potassium is too high. This is known as hyperkalemia. If blood potassium levels go too high, as it does in these cases, it can speed up the decline in kidney function, trigger a heart attack, or lead to heart fibrillation and sudden death. These are serious and life-threatening conditions. If you have high blood potassium, your doctor has already told you to limit your potassium-containing foods in all likelihood. But some people are walking around with high blood potassium levels, which are very dangerous, and they don't even know it. So at your next annual physical exam, make sure your doctor does some standard blood tests, which would normally include looking at your blood potassium levels. It's estimated that about 2 to 3% of the population has high blood potassium. People who are most prone to this condition include those with chronic kidney disease, so about half of patients who are in pre-dialysis, there's kidney decline, have high potassium levels, hyperkalemia. Also people with heart failure, diabetics, and those taking certain types of blood pressure lowering drugs like renin blockers and ARB drugs and some other drugs can actually raise potassium levels. But for most of us, more potassium in our diet would actually be a good thing. In our society, adult women consume only about 2,300 milligrams a day and men consume only about 3,000 milligrams a day. That's a bit low. According to the National Institutes of Health in the United States, adult men and women should be achieving 4,700 milligrams of potassium each day, and it's very achievable just from eating food. In most cases, there's no need to take potassium supplements to accomplish this. Consuming more fruits, vegetables, legumes like beans and peas, nuts, fish, and low-fat dairy products will allow you to easily achieve an intake of 4,700 milligrams of potassium each day. Doing so will likely help to keep your blood potassium down. It'll help to keep your blood pressure down and help to reduce your risk of serious cardiovascular events over your lifetime in all likelihood. In addition to providing the references for this groundbreaking study and other references on potassium, in the text below I've included a comprehensive list of healthy potassium-containing foods showing the amount of potassium contained in a standard serving size. You really should look at that table. So thanks for watching, and I'll see you next time.